Over the years treating thousands of patients, I have come to the conclusion that there are three common reasons why people fail physical therapy. So common in fact that I would argue that the majority of failures can likely be tied back to one of these three reasons to some degree. And nothing highlights this more when you have two people with very similar injuries who experience drastically different results. One person does awesome and recovers within weeks, while the other experiences persistent pain for months to years after. It's like a boat crossing the ocean. Two people can leave from the same port, with one experiencing a smooth and relaxing voyage, sipping on cocktails, while the other finds themselves shipwrecked, making best friends with a volleyball. So why does this happen? Well, just as successfully navigating the open ocean requires careful navigation, working equipment, and favorable weather, recovering from an injury requires a number of things to go right to ensure success. And when someone's rehab strays off course, it's likely due to one of these three very preventable reasons. Reasons that are unfortunately often self-inflicted. But the good news is that these common causes of failure can be prevented. So to ensure you sail off into the sunset instead of into the perfect storm, I am going to cover three of the most common reasons why patients are unsuccessful with physical therapy. Here's some insider knowledge that not many providers are likely going to tell you. We don't really know why the hands-on therapies work. So despite their popularity, the jury is still out as to the underlying mechanisms at play. Now don't get me wrong, I use manual therapy daily with my patients. These passive hands-on treatments can be very helpful in reducing pain and improving mobility. So despite us not knowing exactly why they work, we know they do work, but to an extent. Because here's the thing, relying solely on these passive hands-on therapies won't get you very far in the long run. Evidence has shown that hands-on therapies has short-term effects, and their benefits are extremely limited when used in isolation. Think of manual therapy as a patch on a leaky boat. It can plug up the holes and keep the water out, allowing you to keep on sailing smoothly. But it's not going to be the thing that gets you to your destination. It is only through movement that you expose your body to the necessary stresses needed to promote tissue adaptation, such as changes in strength or flexibility. Physical changes that will lead to lasting improvements and help your body weather future storms. You're not going to get that with hands-on stuff. But despite this, patients commonly rely on passive hands-on therapies while neglecting the active exercise-based approaches that actually do have evidence to support their use. So why is this? Well, besides the fact that anyone would prefer to just lay there and get treatment, I think there are two reasons why manual therapy gets so much undeserved attention. For one, patients believe it is way more beneficial than it actually is. And two, these techniques are very marketable. You've seen it all around. Flashy videos and providers promising the newest and greatest fix. It's hard to resist these seemingly easy solutions. It's effective and gets people's attention, promising fast results with minimal effort. And let's face it, in a world where everything is so fast-paced and instant, the idea of a quick fix can be very tempting. I mean, come on, who wants to hear that recovery takes hard work, dedication, and time? It's not exactly a catchy slogan, and it won't get many clicks or people walking through the door. Quick fixes and instant results are what sell, even though they might not be the most realistic or sustainable solutions. But in reality, the hands-on therapy's true value is realized when they are integrated strategically for the sole purpose of promoting movement. The spotlight should be on an active, exercise-based approach, because movement is the true catalyst to recovery. Engaging in specific exercise and activities tailored to your condition and goals is what truly drives progress and leads to long-term improvements. So if you feel like your past therapies have been too hands-on and not active enough, give it another try. It's likely the reason for your lack of progress. The unfortunate truth is that our healthcare system undervalues insight of patients when it comes to making treatment decisions. This has resulted in a patient population that submits to being a backseat driver to their own care. Well, this can't be the case in physical therapy. Physical therapists need to know exactly what you want to get out of the rehab process. This will provide them with insight into your goals so that they can better tailor their treatment approach to your individual needs. Also, your understanding of exactly what condition you are managing and how to manage it is critical to your success and long-term outcomes. Let's go back to the good old boat metaphor. The physical therapist is like the navigator or map reader, or whatever nautical equivalent to Google Maps is. When it comes down to it, the primary goal of the physical therapist is not to fix you. It's to help you fix you. We are there to help you negotiate the challenges and obstacles that come up during rehab and ensure you recover at the quickest and most effective way possible. The person sitting in that big comfy captain seat steering the ship, well, that's you, the patient. Without your active participation, the ship will drift aimlessly and compromise your chances of reaching recovery. So by actively engaging in your healing process, you will develop a better understanding of your body's capabilities, limitations, and needs. This knowledge allows you to make more informed decisions about your body and enables you to take more proactive steps towards making sustainable lifestyle changes that align with your long-term health goals. This will allow you to better advocate for your health and make choices that prioritize your personal, physical, and emotional needs. So think back. Do you feel like you took on an active part of your rehab? Or do you feel like you were a passenger to your treatment that you didn't understand or buy into? Let me know in the comments below. I would like to hear your thoughts. Compliance with physical therapy is like the fuel that powers the engine of rehab. Without consistent adherence to the treatment plan, progress can really stall. Surprisingly, some studies have shown that up to 70% of people don't comply with physical therapy treatment. That's an incredibly high rate of non-compliance, and is one of the primary reasons for the lack of success. Compliance includes showing up for your appointments and following the advice and recommendations of your physical therapist. But here's the thing. Compliance doesn't stop when you leave the clinic. It's just as important to keep up with your exercises at home. Neglecting to do so outside of your treatment sessions can slow progress and lead to recurring injuries and flare-ups. This is especially true if you have a chronic condition, where ongoing management is key, and that means staying consistent with your home exercise program, because exercising in the clinic 1 to 2 times a week is just not enough. Many of the conditions managed in physical therapy take numerous hours of consistent exercise to cause your body to change. So expecting dramatic changes to occur by doing things only when you show up for your appointments is quite unrealistic, and a big misconception that people have. It is also common for patients to say they felt great during their therapy sessions, only to have their symptoms come back once they stopped going. And this is most often because they stopped doing their exercises. It's like stopping blood pressure medication just because your blood pressure went down once. Think of exercise like washing your body or brushing your teeth. Long-term physical health often requires you to develop certain behavioral habits to maintain physical fitness. By staying compliant and doing those prescribed exercises, you're building strength, maintaining mobility, and preventing your condition from getting worse or coming back. So did you keep up with the therapist's recommendations, or was the lack of success more about non-compliance than the actual rehab itself? Now, if you feel like you checked off all these boxes and did everything you could to succeed in physical therapy, maybe you were just receiving bad care. Unfortunately, not all physical therapy is made equal across the country. Check out this next video where we cover ways to know if you have a bad physical therapist.